Dental issues are no fun. And if you've ever experienced muscle pain, especially along your jaw, grinding or teeth clenching could be the culprit. Dr. Andrea Joy Smith wants to help her dental patients alleviate any pain and fix those problems. She's here now to talk about injecting a modern approach at her practice. Hello, Dr. Smith.
Hello, Aubrey. Good morning.
Good morning. So I've definitely been subject to some pain at times. Why does pain along the jaw from our teeth occur?
It happens mostly because of grinding or clenching, or the medical term for it is bruxism. A lot of patients are not aware that they actually do it, but they're overworking their muscles that normally are only used during eating and chewing. And not only are the muscles being overworked and overcontracted, the teeth are also being damaged by the grinding and clenching of the teeth coming together for much longer periods than normal.
So if someone's not really aware that this is happening, can you tell? If you're doing an exam, can you see that some of this may be occurring?
Yes, actually, I can. There are certain signs that we look for. For the patients that are not aware, they probably don't report any pain. But what I see is a worn dentition, teeth that are really ground down. I also see gum recession sometimes, or sometimes they'll come in with a broken crown or a broken partial or restoration that they've been wearing, and they really wouldn't have an explanation for why it was breaking. And after I evaluate their muscles and look for all those signs that I just mentioned, then I can usually determine that bruxism is usually the culprit.
Well, if they don't know that that's going on, but maybe they're feeling some things, some symptoms, what are those that they should think, hey, okay, maybe I need to get this checked out?
Yeah, sometimes they will hear joint noises like clicking and popping of the TM joint, of the temporomandibular joint, also called the TMJ. Sometimes people will tell me, oh, I have TMJ problems, or I used to have TMJ problems, but that's actually the name of the joint. And you can actually have joint problems as well. So in my office, I also image the actual joint with my CT machine just to make sure that there's no degeneration of the joint going on. But 90% of the time, it's the overworking of those muscles. And if we can do something to stop that, then we can definitely improve their pain. And so what I do in my office for my patients is I use Botox. Botox, yes, that cosmetic medication that we all know that helps relieve muscles. But what it does is it stops the contraction of the muscles. The Botox enters the muscle and it stops that contraction or the overcontraction, because our patients will still be able to eat and chew and do all of the normal functions. It's just that that overworking that's normally happening when they're not aware of it, that will come to an end.
So this Botox, is that like your modern treatment? Because it's not something you really think and associate with the dental office.
Correct. It's a more modern way to treat it. Yes. Traditionally, we would prescribe a night guard, something that is custom made. We take an impression of their teeth and we make it custom for them, and they wear it at night. And the idea of that is to, one, protect the teeth, to stop the breakage of the teeth that happens with grinding, but it also sort of keeps your jaws apart so that you're not able to clench down or grind down as hard. And then that way, all of that muscle pain can be alleviated as well. But what I find is that some patients don't like to wear the night guard, or it interferes with their ability to really get comfortable at night. And so the great thing about using Botox is that it's injected in the muscle and it continually works whether the patient can tolerate the night guard or not.
Well, it's great to hear about your innovation and that it seems to be working for your
Yes.
patients. So someone's sitting there watching right now and they're thinking, okay, yeah, I do tend to maybe grind my teeth or clench, but I haven't had it checked out. How could someone suffering from this issue come into your office to get some treatment?
Yeah. Absolutely. They can definitely call my office at 916-482-8300. And when they come in for the consultation for TMJ problems, I will conduct a muscle examination, and I will look at not only the muscles that are involved in eating and chewing, which are the muscles of mastication, as we call them, but there are a lot of other head and neck muscles that also are painful when this activity is happening. So we will do a complete muscle examination and determine whether or not Botox is actually the right treatment modality for them.
All right, Dr. Smith, thanks for walking us through that and explaining how it all works. It's really interesting. For more on this treatment and all Dr. Smith's services, visit smileagainnow.com.